missing teeth and bone grafting options. We see patients quite frequently that are in need of some type of rehabilitation or dental rehabilitation and are missing teeth, one or more teeth. Frequently, if just a single tooth is missing, there may be enough native bone there and dental implants can be performed without the need for bone grafting. Other more significant cases we see are older people that have lost many teeth, people that have had cancer or radiation, or situations in cleft lip and palate where there may be larger bone gaps or deficiencies, underlying osteoporosis, underlying other systemic issues or conditions where we need to do a lot more bone grafting. So we have our own surgery center here, and patients can go fully to sleep with an MD anesthesiologist, different from oral surgery or periodontal offices. And we're able to obtain your own bone, which is able to work quite a bit better. So we're able to take some hip bone. We have a very special instrument or instrumentation that allows us to get a very high yield of iliac crest cancellous bone from a very small incision. And this bone, especially when we mix this with things like platelet-rich plasma, and we have several tools to help in the sites of the jawbones to prepare this to receive bone, tends to do very, very well. So in cases of prior failed bone grafts, large sites that require reconstruction, this is something we do, and we have the latest technology, techniques, use of your own cells to provide bone grafting and ultimately to help restore missing teeth. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.